Hello everyone, my name is Haley Kropp and I am a student in the LPN to BSN program at Indiana State University. So today we're going to talk about how we can help soldiers with PTSD. And the person at risk for PTSD is soldiers that have experienced combat. So let's talk about what PTSD actually is. I think that sometimes there's some confusion of what PTSD is, where it comes from. PTSD stands for post-traumatic stress disorder, and it's a mental condition that develops after exposure to trauma. PTSD can occur after exposure to one horrifying event or multiple prolonged events. So what that means is that you could go and have one event that happens to you, and then you come home and you're diagnosed with PTSD, or you could be in an abusive relationship, be sexually abused over a long period of time, and then develop PTSD. And also, just because you are exposed to an event doesn't mean PTSD symptoms are going to spring up right away. It might take months, even years, before you experience any symptoms of PTSD. Now, what causes PTSD? And I mentioned before that there's a few things that can cause PTSD that aren't related to soldiers. But for this presentation is for helping soldiers. So I want us to focus on them and what causes PTSD in them. So soldiers can develop PTSD after being exposed to combat, after discharging a weapon, witnessing a death or injury, being responsible for a death or injury, and deployment-related stressors. There's so many more factors that can cause PTSD in soldiers, so many little things that they have to go through. Now, deployment-related stressors, what that is, that could be your family life, what you're leaving at home, your wife, your children, your home, all these things that you've left behind. That's a big stress and a big change. Sometimes that's even enough to cause PTSD in soldiers. There's some soldiers that come home from Iraq and they are diagnosed with PTSD and they try to determine, where did this come from? You did not experience any combat. We'll come to find out it was the cumulative stress of the whole situation. So what is the prevalence and risk factors of PTSD in American soldiers? It's kind of hard to determine the actual prevalence because so many people are afraid or ashamed to admit that they think they have PTSD and they go undiagnosed. So from the reported cases, PTSD occurs in 1.09% to 34.84% of American soldiers. And there's a few risk factors that might make someone more susceptible to getting PTSD, and those are being female, ethnic minorities, having a low education, not being an officer, being in the Army compared to the other branches of service, the combat specialization, so what your job is in the service, how many times you've been deployed, how long you've been deployed, adverse life events, prior trauma, and prior psychological issues. So if someone that is already suffering and then they deploy and they're faced with some trauma, they might have a higher risk of being diagnosed with PTSD. What are the physical effects of PTSD on the body? Researchers explain that this is something that's kind of hard to measure. A lot of these symptoms are self-reported and there's no way to measure them, such as abdominal discomfort, headaches, and fatigue, since the soldiers are reporting these symptoms. However, researchers and medical doctors explain that cardiovascular effects are noted on EKG. You can actually see when a soldier that has PTSD is having cardiovascular changes related to the disorder. What are the psychological effects of PTSD? The soldier may experience flashbacks, intrusive thoughts, insomnia, hyperarousal, nightmares, agitation, irritability, impulsivity, anger, numbness, feelings of fear, guilt, or shame, withdrawal, avoidance, confusion, disassociation, depression, anxiety. So soldiers may experience these flashbacks, and these flashbacks are intrusive, and it's something that sometimes they just can't control them. And sometimes these thoughts may cause insomnia, or even the nightmares may cause insomnia. The soldier may also be hyperaroused, and that might cause some paranoia, and they might be excitable, or they could even be agitated, irritable, and angry. Sometimes the psychological effects of PTSD makes the soldier impulsive, where they may make big purchases or say things without thinking about it, or they may withdraw. They may stay home. They may not exhibit any emotions. They may not feel any emotions. They're just kind of numb, and they're trying to push down the thoughts that they're having and the feelings that they're having. And most importantly, the soldier may be depressed or have anxiety. And major depressive disorder can be related to PTSD. It's a really big symptom and something that is hard for the soldiers to deal with. It's important for the loved ones of soldiers to be educated about PTSD so that they can monitor their soldier when they come home from Iraq or from any other tour of duty. So the loved ones can monitor their soldier from insomnia or nightmares. And nightmares are evident when the soldier is restless in their sleep, yelling in their sleep, maybe reaching out or trying to hit something in their sleep. Have you noticed any sudden behavioral changes, anger, irritability like we previously talked about? Are they being withdrawn? Are they staying home? How do they behave in public? Have you noticed a change in your relationship with the soldier? Have you noticed your soldier making large unplanned purchases or exhibiting any other impulsive behaviors? Have the symptoms of stress been occurring for a long period of time? Because sometimes people are just stressed, but that's normally a short period of time. If it's something that's gone on for a long period of time, it's possible your soldier could be experiencing PTSD. Have you noticed your soldier suddenly breathing heavy, sweating, or complaining of sudden nausea? Has your soldier exhibited signs or verbalized an inclination to harm themselves? And has the soldier developed an addiction suddenly? Sometimes soldiers will use alcohol and drugs to numb their feelings and to deal with their pain without having to go to a professional. Treatment for PTSD can include non-pharmacological or pharmacological, and they can even do them side by side at the same time. Non-pharmacological consists of cognitive behavioral therapy, which includes cognitive processing therapy and prolonged exposure. Cognitive processing therapy focuses on the impact of the trauma, while the prolonged exposure helps the soldier to revisit the trauma while they're in a safe clinical setting. The soldier may also be put into eye movement desensitization and reprocessing, which is where the soldier will have their eyes closed. They'll speak about their feelings while completing eye movements and undergoing certain taps and movements. Pharmacological treatment includes antidepressants, and the first line of defense in antidepressants is the SSRIs. Second, they may include other antidepressants if that was not successful. They may also include antihypertensive drugs, anticonvulsants, and anti-epileptic medications. Treatment for PTSD is so important because PTSD can often lead to suicide. And according to the Department of Veterans Affairs, the rate of suicide has been increasing. Currently, approximately 38.3 soldiers out of 100,000 commit suicide due to PTSD. It might be difficult to determine if a soldier has PTSD, but hopefully with this education, you'll feel more prepared to determine if a soldier has PTSD. If you suspect that a soldier has PTSD, it's important to reach out for professional assistance. If it becomes necessary, you can call the Veterans Suicide Hotline. The numbers provided. Contact the VA for assistance in seeking therapy if the soldier is no longer on active duty. If they are on active duty, contact the chain of command because they'll be able to put you in contact with who you need. And even the Family Advocacy Department can be contacted through the chain of command.